Good evening, and thank you for joining us tonight for this Medicare webinar series and tonight's topic, Medicare Options for Medigap and Medicare Advantage Plans, presented by the Pikes Peak Area Agency on Aging. We would like to thank the Pikes Peak Library District for its partnership and support of this webinar series. Before we begin, we ask that you please mute your microphones until we have reached the question and answer portions of the presentation. And now it is my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging. Roma, it's all yours.
Thank you, Jared. So good evening, everyone. Thank you for joining us for tonight's part 2 of our 4-part Medicare 101 series. Tonight, we're going to be talking about Medigap and Medicare Advantage plans specifically. Hopefully everybody has received the email that I sent out earlier today that included all of the handouts and a copy of this presentation or a copy of the slides. If you did not, you're welcome to enter your information into the chat and we'll make sure to get that email sent out to you so you have that material. We're going to cover a lot of information tonight. I will absolutely pause during the presentation to allow for questions. If you have questions, you're welcome to type questions into the chat at any time and I will address them at the pauses. Or when I do pause for questions, you're also welcome to simply unmute or raise your hand and ask your question live. And with that, we will go ahead and get started. So again, tonight we're talking about Medigap and Medicare Advantage plans. Just to recap, we're going to review the Area Agency on Aging, and the mission of the Area Agency on Aging is to work with our 3 county partners, El Paso, Park, and Teller, to provide leadership and advocacy on all things and concerns and needs of this older adult population in those areas, in order to develop programs and systems that allow people to stay in the community for as long as possible. I am the coordinator for the SHIP program, which is part of the Area Agency on Aging. The SHIP program is a federally funded program that's designed to provide free and unbiased information and education on all things Medicare and all things potentially related to Medicare. This SHIP office in Colorado Springs covers a total of 9 counties in Colorado. You can reach us by our local Colorado Springs number, or you can reach the SHIP program from any county in Colorado by calling the statewide toll-free number, which will route you to the SHIP program closest to where you're calling from. So a quick recap of what we covered last week, which was original Medicare Parts A and B. We talked about eligibility and enrollment. We talked about benefits and costs. Medicare Parts A and Part B are considered your original Medicare benefits. And tonight we're going to talk about insurance options that are available to anybody with Medicare out on the open market, basically, which are Medicare supplements, also known as Medigap, or Medicare Advantage plans, sometimes referred to as Medicare Part C. Both of these kinds of insurance are available, again, to anybody with original Medicare, but you have to have both A and B of Medicare. These programs are regulated by Medicare, and there are limited enrollment opportunities for most people to enroll in these kinds of options. We are going to start with Medigap, or Medicare Supplement Insurance. All right, so Medicare Supplement Insurance, or Medigap. Basically, Medicare Supplement Insurance is a private health insurance policy that is solely and specifically designed to supplement the costs that Medicare Part A and Part B left over after they paid their part first, period. Let me say that again. Medicare Supplement Insurance policies, or Medigap policies, are private insurance policies sold by private insurance companies, but they are solely and specifically designed to supplement or pay the balances left over after Medicare Part A or Part B paid their part first, period. These kinds of insurances are sold by private companies. They do follow all federal and state laws and regulations. If you purchase a Medicare supplement or Medigap policy, that policy itself must say Medicare supplement insurance, those 3 words in that order, for it to be a legitimate policy. The phrase Medigap comes from the thought process that it covers the gaps in your original Medicare benefits, i.e. the cost that Medicare leaves over, such as your deductibles. And there are different levels of coverage to choose from when looking at Medigap policies. Those levels of coverage are classified by alphabet letter designations, A through N. There are approximately 10 different levels of coverage to choose from, with the exception of 3 states listed on the slide that have an additional level of coverage to choose from. And from purchasing these kind of insurance policies, costs do vary from company to company. It can vary by the level of plan that you choose. It can vary by the company that you choose. It can vary by where you live, by your age, by your smoking status. So there are a lot of variables that go into determining what the costs will be for this kind of insurance. And we're going to talk about a little bit about all of that. So how do these kinds of plans work? Well, these kinds of plans are only good with original Medicare A and B. You have to have both A and B of Medicare to purchase this kind of coverage. But there may be some instances where you don't need this kind of insurance. For example, if you are already enrolled in a Medicare Advantage plan, you do not need and cannot enroll in a Medigap or other types of Medicare plans. If you have other types of credible coverage available to you, such as TRICARE for Life if you're retired military, or if you have a retirement health plan option through your employer, such as if you paid into PARA or if you're a federal civil service retiree, you may not need a Medigap policy. Because these kinds of insurance policies work specifically with original A and B of Medicare, these policies are designed to basically be secondary insurance to Medicare. And because it is solely and specifically designed to pay what Medicare left over after Medicare paid first, you can go to any doctor, hospital, or provider of any kind that accepts original Medicare as your primary insurance anywhere in the United States and/or our territories. And as long as Medicare pays their part first, your Medicare supplement pays the balance, depending on the level of coverage that you choose. So it does make it the most portable option for health coverage to go with Medicare, which can be particularly important if you intend to move from one area to another, or if you intend to travel once you stop working for extended periods of time. So who can buy a Medigap? Well, again, you have to have both Part A and Part B of Medicare. But as long as you have Part A and Part B of Medicare, you are potentially able to buy this kind of coverage, regardless of age and regardless of anything else, except for certain situations. So there are times that are better to try and purchase this kind of coverage than others. What people don't typically understand about this kind of insurance is that this kind of insurance is allowed to underwrite in certain situations. And when I say underwrite, what that means is they're allowed to look at your health history in certain situations, and if they don't like what they see, they do not have to sell you insurance. Which means, and that's where having a specific time frame to enroll in this kind of coverage can be important. Also in the state of Colorado specifically, and other states, but not all states, Medigap is required to be sold to people who are on Medicare due to being on Social Security disability, meaning they are on Medicare and under age 65. In Colorado, Medigap plans, insurance companies are required to offer the same opportunities for purchasing this kind of coverage that they offer to people who are turning 65 or older to people who are under 65. Not every state has that provision. However, there is a catch to all of that. If you are purchasing this kind of coverage under 65, it will be more expensive because you are under 65. However, if you purchase this kind of coverage or not, if you're under 65, when you turn 65, you would get a second opportunity to purchase this kind of coverage at a lower cost. And that is because of what they call guarantee issue. So anybody who is becoming eligible and enrolled in Medicare A and B for the very first time, whether it's based on becoming eligible for Medicare due to disability, or becoming eligible for Medicare by turning 65, or becoming eligible to enroll in Medicare because you are finally no longer going to be employed. When you have both original A and B of Medicare in effect, you are provided with what's called a guarantee issue period for Medicare supplement insurance. That guarantee issue period lasts for 6 months from the time your A and B are both in effect. It is sometimes referred to as the Medigap open enrollment period, and it starts the very first day your A and B, both A and B, are in effect. Once the 6-month clock starts ticking, you cannot stop it. Once it expires, you cannot get another one except for in very, very specific scenarios. And what this 6 months of guarantee issue provides you is the ability to purchase this kind of coverage without underwriting. So you can purchase any level of coverage from any company you want every month for 6 months. You can change to a different company or a different plan, and you would not be underwritten, meaning they cannot turn you down for purchasing this kind of coverage based on pre-existing health issues. But again, it's a 6-month window. Once it expires, it is gone. And if you miss this 6-month window and you have pre-existing health issues, if you miss this 6-month window and then try and purchase this kind of coverage, you could be underwritten. And if you are underwritten, you could potentially be denied coverage or the ability to purchase this kind of coverage. The only special scenarios that would allow you to have another opportunity to have guarantee issue into this kind of insurance outside of when you first get Medicare would fall under what they call a special enrollment period. There are a couple of scenarios that will usually apply in this situation, but primarily any type of special enrollment period into any type of Medicare related insurance product is always going to be available to people in a situation where you have involuntarily lost other creditable coverage. Examples of other creditable coverage include employer coverage through active employment. It can include coverage that you had from an employer for retirement health benefits that have suddenly gone away, if those health benefits were designed to coordinate with Medicare. That can also include COBRA coverage. Another opportunity that you might get to have guarantee issue into a Medicare supplement policy would be surrounding your enrollment into a Medicare Advantage plan, which we will talk about in great detail when we get to the Advantage plan section of this presentation. But primarily, it's even in that scenario, it's going to be involving some form of loss or involuntary loss of other creditable coverage. So that is really the key to any opportunity to make a change to your current insurance or to make a change to your coverage with Medicare. Medicare supplements are only designed to pick up the balance that Medicare left over. So if for some reason you receive a medical service and Medicare decides to not pay for that service because they deem it wasn't medically necessary, the supplement will also not pay anything for that service. It is only designed to pick up the balance after Medicare paid their part first. It also does not pay for anything that Medicare does not pay for. Examples of things that are not covered by Medicare or Medigap are going to be long-term care, custodial care, dental or vision or hearing aids, private duty nursing, and then outpatient prescription drugs because those would be covered under a Medicare Part D benefit. But again, this kind of insurance is only designed to pick up the balance after Medicare pays their part first. So if Medicare does not pay for a service, this insurance will not pick it up either. Are there any questions about any of that so far? Again, if you have a question, you can type it into the chat, or you can raise your hand and ask your question. All right, I'm not seeing any questions in the chat, and I'm not hearing any questions or hands raised. So in the email that I sent earlier today, I included several handouts, and a couple of them were specifically regarding Medicare supplements. The first handout that we're going to look at is this chart. This chart details the levels of coverage you have to choose from for purchasing a Medicare supplement insurance. As I mentioned before, the levels of coverage are categorized by alphabet letter designations, and they're called plans, not to be confused with Medicare Parts. So Medicare Parts A and B versus supplement plans A, B, C, D, etc. So if you go with this option as insurance to go with your original Medicare, you would have Part A and B and supplement plan, whatever you choose to purchase. On this chart, what we're looking at is under each plan letter designation, there is a list of benefits that plan covers after Medicare has paid their part first. So for example, if we look at supplement plan A, there's only one item listed under plan A, basic benefits, including 100% Part B coinsurance. What that means is this plan only pays, if you purchase a supplement plan A, it only pays the 20% that Medicare left over for Part B services, your outpatient services. Does not pay any deductibles or any other benefit, just the 20% for Part B services after you've met your deductible, those outpatient services. If we look at supplement plan B, it pays those basic benefits, the 20% for Part B services. It also pays your inpatient Part A hospital deductible every time you're admitted to the hospital. But that's all it pays is the Part B 20% and your Part A hospital deductible every time you're admitted. I'm going to skip over to Plan D supplement. Plan D supplement pays the 20% for Part B services, your outpatient services. It pays the coinsurance for skilled care, that skilled facility nursing stay that we talked about last week, where Medicare pays 100% if you are admitted to a skilled facility after a hospitalization of 3 days or more. Medicare pays 100% for the first 20 days of that skilled facility or rehab stay. But starting at day 21, Medicare pays everything except for $200 a day. Plan D and higher pays that $200 a day up to day 100. Plan D also covers the Part A hospital deductible every time you're admitted. And Plan D also has a foreign travel emergency provision. There are a few plans that include the foreign travel emergency provision. What that benefit actually is not, it's not travel insurance per se. It's not insurance where if you are traveling overseas and you cut your finger and have to go see a doctor, it's not necessarily going to pay for that at the time you have that incident. Basically, it's more or less a reimbursement situation. So if you are traveling overseas and you have a medical emergency while you're outside of the country, basically you pay for that emergency while you are experiencing it. But once you get back home, you can take the bill for that emergency or the receipt for that emergency, and you can submit it to your supplement for reimbursement. Now, your supplement is going to require that you take that receipt and turn around and bill it to Medicare, so Medicare denies it, so that they have a denial from your primary insurance showing that Medicare is not going to pay for that emergency because you were out of the country. Once you get that denial from Medicare, you resubmit the denial from Medicare plus your receipt to your supplement. They will reimburse you 80% of the cost of that medical emergency after a $250 deductible. So again, it's not insurance you use while you're overseas, but it is reimbursement of any medical emergency expense you might incur. The next plan we're going to jump to is Plan G as in goat. This plan is considered the most comprehensive level of coverage. It pays Part B basic benefits, the 20% coverage. It pays the skilled nursing facility coinsurance starting at day 21, pays your hospital inpatient deductible every time you're admitted. It pays foreign travel emergency reimbursement. It also includes a benefit called Part B excess. Part B excess, when you have original Medicare and a Medicare supplement, is basically terminology on how doctors get paid for the services that they provide to you. There are basically two ways doctors can get paid by Medicare when original Medicare is your primary insurance. The first way a doctor gets paid when they take Medicare as your primary insurance is, say you have just a regular office visit. So you go to see your primary doctor for a regular office visit. If you didn't have any insurance, that doctor would charge you $300 for that office visit. But you have Medicare. By law, any provider who treats you and knows you have Medicare is required to bill Medicare for you. Medicare does not want you to bill them yourself. So you go for your office visit. Your doctor is going to bill Medicare their retail price of $300. Medicare is going to turn around and say this type of service is worth $100. Medicare is going to pay 80% of that $100 that they have determined that service is worth. So doctor bills Medicare $300, Medicare turns around and cuts that down to $100 and pays the doctor 80% of $100. Medicare pays that doctor directly. They send the balance of that $100 to your supplement. The supplement pays the other 20 of that $100 directly to your doctor. The doctor gets paid a total of $100. So even though he billed Medicare $300, that doctor knew he was only going to get $100 total. In that scenario, that doctor accepts Medicare assignment. He accepts whatever dollar amount Medicare assigns for his services as payment in full. He has to write off the other $200 that he billed Medicare as if it never existed. Again, that's called Medicare assignment. Most doctors accept Medicare assignment and will accept whatever Medicare determines they're going to get paid as payment in full. And Medicare will pay that doctor directly. The other way doctors can get paid is kind of similar. You go to your primary doctor for a regular office visit. That doctor is going to bill Medicare their $300 retail price for that visit. When Medicare gets that claim, Medicare is going to notice that that doctor does not accept Medicare assignment. What that means is when a doctor does not accept Medicare assignment, that doctor is allowed to charge you at the time of visit a little bit more than what Medicare would allow. So even though that doctor doesn't accept assignment, that doctor is still limited to what Medicare allows for services. So he bills Medicare $100. He knows Medicare is going to reduce that, or bills Medicare $300, knows Medicare is going to reduce that to $100 and only pay 80%. But when a doctor does not accept assignment, that doctor is allowed to charge you at the time of service 15% above what Medicare allows. So when you go for that visit, that doctor is actually going to ask you to pay $115 before you leave the office. He still has to bill Medicare. Medicare is still going to process that claim. But because Medicare is going to see that doctor does not take assignment, Medicare is going to assume you've already paid the doctor at the time of visit. So when Medicare processes that claim and pays that 80%, Medicare is going to send that $80 to you directly. Medicare is going to forward the balance of $20 to your supplement. The supplement is going to pay you the balance of $20 directly. If you have Plan G that includes a Part B excess benefit, that plan, in addition to the $20 that Medicare left over, will also reimburse you the extra $15 you paid on top of that. So you would get all your money back that you paid up front. So that doctor, again, does not take assignment. He's allowed to charge you a little bit more and will ask you to pay that up front, versus a doctor that takes assignment that will rely totally on Medicare to pay them directly and your supplement to pay them directly and accept whatever that payment is as payment in full. I do see a quick question here. How do you know if your doctor accepts Medicare assignment? That's a really good question. Most doctors accept Medicare assignment. Usually the only way to know the difference, and there's some obvious ways and some less obvious ways. The most obvious way is if you go for an office visit with a new doctor and you have your visit and then they ask you to pay at the time of service, that typically means that that doctor is not going to accept assignment. Again, they still by law have to bill Medicare for you, but they can't ask you to pay up front. Most of the time, a doctor's office will have a sign somewhere in their office that says payment is expected. If you have Medicare, payment is expected at the time of service. Even most doctor's offices, if you ask the receptionist, does this doctor take assignment? They'll honestly not have much idea of what you're talking about. You can simply ask, do I have to pay up front, even though you're going to bill my Medicare, or are you just going to wait for Medicare to pay? That's the easiest way to find out. Again, most doctors take assignment, so it's not a very common occurrence, but I do know that there are a couple of doctors' practices in town that do not. So it's always a good idea to ask, especially if you're looking at getting a new doctor or changing doctors. And it's simply easier to just ask, you have to bill Medicare. Do I have to pay up front, or do you rely on Medicare to pay you? And I would ask that typically at the time you make your appointments. So back to this chart real quick. The last 4 plans shown on this chart, K, L, M, and N, include basic benefits, skilled facility care, and your hospital inpatient deductible. The difference between these 4 plans and the rest of the plans we talked about is that typically these 4 plans will pay those benefits after Medicare at a reduced percentage. So for example, Plan K pays 100% for basic benefits, for preventive care and hospitalization care, but it will only pay 50% for most Part B balances. It only pays 50% of the skilled facility rehab coinsurance. It only pays 50% of your hospital deductible. Plan L pays those same benefits at 75% after Medicare. Because those 2 plans have such reduced payout after Medicare pays their part first, these plans are significantly less in premium, and they do have max out-of-pocket limits, meaning if somehow after Medicare paid their part and your supplement paid their part of 50 or 75% of that balance, and you still had to pay a little bit of your part, if what you pay out of your pocket were to reach or accumulate to those maximum out-of-pocket limits, which for Plan K is $6,940, and for L it's $3,470. If somehow you manage to pay that much out of your pocket after both insurances paid first, for the rest of the calendar year, that plan would have to pay 100%. The likelihood of you ever reaching those max out of pockets is pretty slim, because they're so high based on what you actually have to pay after Medicare and the supplement pay their parts. But again, those premiums are significantly lower than other options. Plan M and N pay 100% for Part B coinsurance, except N does require that you pay $20 for basic office visits and $50 for ER visits, like a copay. It pays 100% for Part B services for everything else, but for office visits or emergency room visits, you would have a copay. They both pay 100% for skilled facility coinsurance. Plan M only pays 50% of your hospital deductible, but Plan N pays 100% of your hospital deductible. Both of those plans do have that foreign travel emergency provision. So there's quite the mix of benefits that you have to choose from. Prices do vary based on that level of coverage that you choose from. So obviously the more an insurance company would pay out in that level of coverage, the slightly higher the premium you could also potentially pay. I can tell you that by law, the only plan that Medicare requires a company to sell and still be considered a Medicare supplement insurer is Plan A, which is woefully inadequate. Most every plan will offer a Plan G as in goat, because it is considered the most comprehensive level of coverage you can buy. And most plans also cover or offer a Plan N as in Nancy. It has become a very popular option because the premiums can be much lower than other options, but the coverage is still relatively good. What I usually encourage people to do is pick your level of coverage first if this is the kind of insurance you are considering. Determine what level of coverage you would be comfortable having for the next 20 or 30 or more years. Because again, if you purchase this kind of coverage when you first get Medicare, you can keep this coverage forever, and whatever level of coverage you choose from will stay at that level of coverage for as long as you have it, for as long as you pay the premiums. These levels of coverage will not change ever. So what the best level of coverage you can buy, or that you choose to buy, is the level of coverage you will have forever. But if you ever want to change your level of coverage or go to another company or try and find a cheaper premium, again, if you're not within your 6 months of guarantee issue, you could be subject to underwriting if you try and make that change in the future. And if you have any sort of pre-existing health issue at that point, it could become very difficult or impossible to find another company that would be willing to insure you. Even if you're looking at changing the level of coverage within the company that you are currently insured with, they are allowed to underwrite you. And they could turn you down if you have pre-existing health issues. So keep that in mind. Once you're in with this kind of policy. But once you're out, you could potentially be out. I'll take a couple of quick questions that I see in the chat. When buying a supplement plan, do you identify Plan G, K, etc. to the company? Well, certainly if you call any of these companies, they're going to want to give you the song and dance, their sales pitch. But if you call them and you are comfortable with the information that you have and you know what plan you want, and you just call them up and say, I want to buy a Plan G, they're happy to do that as well. So it is helpful if you don't want to sit there and listen to the song and dance. The next question is, what if you have medications that are high? Like for rheumatoid arthritis, does that mean a different plan? No. If you buy any of these plans during guarantee issue, that 6-month window of guarantee issue, you can buy any level of coverage from any company you want, no questions asked, because they cannot turn you down for any reason whatsoever if you are in that first 6 months of guarantee issue. But once that 6 months expires, something like taking a medication or having been diagnosed with a medical condition could potentially severely hinder your ability to make any changes. The other handout that I sent you is this document, Medicare Supplement Insurance Policies in Colorado. It is dated September of 2022, but it is the most current document. This document is put together by the Division of Insurance up in Denver. We are very fortunate in Colorado that they take the time to do this for us, because it is very labor intensive to put this together every year. But what it is a list of all the companies licensed to sell this kind of insurance in the state of Colorado. And it shows you that information. It shows you information based on these charts. So the first half of this document is basically going to give you brief paragraphs about everything we've talked about so far. The second half of this document is going to show these charts. These charts are organized by age group, and each age group has 2 pages. Age groups start at age 65, So it goes 65 to 69, 70 to 74, so on and so forth. It's going to list every company licensed to sell this kind of coverage in alphabetical order across 2 pages. There are over 40 companies listed. It's going to have that A through N across the top. If you go down the side and pick a particular company, so say we go down this page and look at Physicians Life, for example. If we scroll across the page with Physicians Life, if there is a number in any of the boxes, you look up to see what plan level that is. If there's a number in the box with that plan level, that represents the approximate monthly premium for that plan with that company at that age group. Now, you'll also see a bunch of empty boxes, meaning the company doesn't sell that particular plan. But this will give you an opportunity to kind of see what companies charge for premiums and what companies charge more for premiums than other companies. The most important thing to remember about this kind of insurance is a Plan G is a Plan G is a Plan G, no matter who you buy it from. They are all selling you the exact same product. They cannot alter those plan levels in any way, shape, or form. They're set in stone. A Plan N is a Plan N is a Plan N, no matter who you buy it from. So it becomes more important to determine the level of coverage that you want to live with, and then it pays to shop around, is the bottom line. There is absolutely no advantage to paying a higher premium for a plan with one company when another company sells it for a lower premium. You're not getting any extra benefit. You're not getting better customer service. There's no advantage to doing that. The numbers, the prices represented in these charts, I want you to keep in mind are estimates. They're in the ballpark, but they're not exact price quotes. And that is because prices can vary based on location. They vary by zip code, they vary by state, and vary by company, to name a few. But these price quotes are going to be in the ballpark. So it's going to give you a good idea of what companies charge more, what companies charge less. It's going to give you the price range that you're looking at for your age group. Now, because these are grouped in 5-year age groups, some companies may have a different price per your specific age. So at 66, 67, 68, they could have a different price group. Some companies may charge the same price for that whole age group. It varies from company to company. In the handout in the pages prior to these charts, it does kind of explain the difference between how companies rate their plans by age, because there's 3 different ways they can do it. And that's always something to be aware of and ask about. You'll also notice right next to the names of each company, which also includes a contact phone number if you wanted to call them, there's a little note section that has some like note keys that correspond to a key page right before these charts start. And these notes represent whether or not they offer household discounts or multi-policy discounts, whether or not the company charges an application fee, which you really shouldn't be paying an application fee, and things like that. So those are things that you'd want to look at as well when you're looking at these individual companies. I do notice over time that more and more companies are starting to charge an application fee. So do be aware of that. Most application fees run $15 to $25, but there are certainly still plenty of companies that do not do that. So again, look at the level of coverage you're comfortable with first, and then start shopping for the best price for that level of coverage from the companies. I do have another question. Do they get to offer different benefits, such as Silver Sneakers, which is a free gym membership? So typically, those free gym memberships are usually offered as incentive benefits from Advantage plans. However, Some of the bigger companies such as AARP United, Humana, Blue Cross Blue Shield, Anthem Blue Cross Blue Shield, some of the bigger companies, because those bigger companies have their fingers in all the pots. So they sell Medicare supplements, they sell Medicare Advantage plans, they sell Medicare Part D drug plans. Because they have their fingers in all the pots, they may also offer those little extra benefits like free gym memberships with their supplements. So I know for a fact that Kaiser does that. Well, Kaiser doesn't sell supplements, but Humana does that and Anthem does that. And I think AARP does that, where you can get like a free gym membership if you buy their supplement without having to buy their Advantage plan instead. And then another question, what is pre-X or pre-X stands for pre-existing. So if for some reason you find yourself without any insurance at all within 6 months of becoming enrolled in Medicare for the first time, if you've been uninsured completely, and a lot of the rules and the new federal laws, Obamacare, all of those things were designed to eliminate this possibility that you are uninsured at any point in time. But if you somehow manage to be uninsured for longer than 6 months, within 6 months of enrolling in Medicare, these plans, even in guarantee issue, could potentially impose a pre-existing exclusion to your policy. Meaning if you have a pre-existing health issue, they still have to sell you a policy, whatever level you want from any company. But when you answer those health questions, because they are on the applications and you do have to answer them, when they look at your health questions, if they determine you have a pre-existing health issue and you've been uninsured for longer than 6 months, they could impose a limitation that says we're not going to pay our part after Medicare for any services you receive related to this specific pre-existing health issue for a maximum of 6 months. I haven't seen this happen in a very long time because most people have managed to find a way either through the marketplace or through Medicaid to be insured if they're not employed. But that's how that would work, but you'd have to have been uninsured for at least 6 months prior to getting enrolled in Medicare for that to apply. So that is Medicare supplements in a nutshell. Any other questions about those benefits? Again, the handouts that I sent you are good tools to use. If you want exact price quotes for any level of coverage from any plan, you do typically have to contact them directly. You could try accessing a broker, an insurance broker. An insurance broker is an insurance agent that actually sells multiple insurance companies. And if you can find a broker that sells multiple insurance supplement companies, you can actually let them do all of the work for you and just come back to you with some price quotes on the plans that you are interested in. An insurance agent is typically going to be dedicated to just one company, selling insurance options for one company. But if you know what company specifically you want, then you could certainly contact an agent for that company directly as well. Do insurance brokers make money from us? No, that you do not get charged more or extra if you use an agent or a broker. You pay the same premium if you call them directly or if you use an agent or a broker. They get paid by the insurance company, not by you, for making a sale if you use an insurance agent or broker. So that does not affect your price at all. Any other questions? All right, so those were good questions. Again, these handouts are good tools to have. They're a good place to get you started. And they can have some good information. But these prices, again, are not designed to be specific quotes. If you need a specific quote, you need to contact the companies directly. All right, so that is option one for insurance options to go with your Medicare. Now we're going to talk about Medicare Advantage plans. And this is where it can get a little more complicated. So, Medicare Advantage plans. Medicare Advantage plans are also policies that are sold by private insurance companies. The difference is that these insurance companies contract directly with Medicare. And when they contract with Medicare, that contract means that they are going to act as Medicare if you enroll in these plans. So Medicare Advantage plan basically becomes your Medicare because of these contract agreements. You still have original Medicare no matter what you enroll in. You still have to pay your Medicare premiums. But when you enroll in a Medicare Advantage plan, that plan becomes your Medicare, meaning all services and all benefits go through that plan instead of original Medicare. You are still allowed all your rights and protections. They still have to follow all state and federal laws and regulations. And you're still going to get all the services original Medicare covers. However, they're called Medicare Advantage plans because they are typically going to have some advantages over original Medicare and a supplement. And those advantages are typically going to be in the form of extra benefits. Extra benefits being usually things that are not covered by original Medicare, such as some routine vision, dental, hearing, free gym memberships. As time has gone on, these plans have been allowed to expand the number of and the type of extra benefits they're allowed to offer. So now a lot of these plans come with quite a bit of these extra supplemental benefits. Most Advantage plans will also include Medicare Part D drug coverage. If you go with original Medicare and a Medicare supplement that does not include drug benefits, you'd have to purchase a drug plan separately in addition to original Medicare and a supplement. With Medicare Advantage plans, most of the time, the Part D coverage is included as part of the deal. There are some additional requirements to enroll in Advantage plans. So additional eligibility requirements mean that you must live in the plan's service area. What that basically means is you can only purchase Medicare Advantage plans or enroll in Medicare Advantage plans that are available for enrollment in the county you reside in. If you leave that county or move to a different county, you have to find a different plan in the different county. So these plans are only allowed to be accessed and enrolled in the county you reside in. Again, you must have both A and B parts of Medicare. And there could be more limited times, or actually there could be more opportunity based on enrollment periods to enroll in this kind of coverage. So there are additional opportunities to enroll in a Medicare Advantage plan in addition to your initial enrollment period. So when you are looking at supplements, you can enroll in a supplement at any time. There is no annual enrollment period for a supplement, but you could be limited to that 6-month window of guarantee issue where they don't underwrite. Outside of that 6-month window of guarantee issue, you can try and enroll in a Medicare supplement policy at any time for any reason. There's no annual enrollment period for them, but you could be limited to what you can change to based on your health. With Advantage plans, there are annual enrollment periods where you can look at getting into, getting out of, or switching from one Advantage plan option to another. So in addition to your initial enrollment period when you first get Medicare, other enrollment periods include the annual election period, or what we refer to typically as open enrollment every year. Then Medicare reinstated the annual Medicare Advantage plan open enrollment period, which is an additional window of time to make a change. And then there are special enrollment periods that people who involuntarily lose their coverage would fall under. So again, the annual election period is that annual fall window, October 15th through December 7th. During this window of opportunity, you can get into, get out of, or switch from one plan to another for both Advantage plans and standalone drug plans. Any change you make during that time frame to those two options goes into effect automatically January 1st. And this is every year, this is the longest standing enrollment period. In 2018, Medicare initiated this enrollment period. This enrollment period, the Medicare Advantage open enrollment period, is specifically for people who are enrolled in a Medicare Advantage plan as of January 1st of any year. If you are enrolled in an Advantage plan on January 1st of any year, you get an additional 3-month window, January 1st through March 31st, to either change to a different Advantage plan than the one you are currently enrolled in, or to drop Advantage plans altogether, go back to original Medicare, and enroll in a separate standalone Part D if your Advantage plan included a drug benefit. If you are not enrolled in an Advantage plan on January 1st of any year, this enrollment period does not affect you because you cannot do anything if you are not enrolled in an Advantage plan on January 1st. So this just basically gives people who enroll in an Advantage plan and it goes into effect January 1st an opportunity to change their mind and either go back to original Medicare with a drug plan or to a different Advantage plan. The one thing it does not do in that situation is guarantee you back into any other coverage such as a supplement outside of very specific situations. So if you've been in an Advantage plan for a couple years, you decide suddenly in January or February that you don't want it anymore, you want original Medicare back, you can certainly go back to original Medicare and drop your Advantage plans altogether, get a Part D plan, but you do not have guarantee into a supplement in that situation. Special enrollment opportunities are going to involve, again, some sort of loss or involuntary loss of your coverage. So I said that you have to enroll in a plan that's available in the county you reside in, but there's a couple of ways that that coverage could go away through no fault of your own. For example, if you live in El Paso County, you've enrolled in an Advantage plan here, and then you decide to move to Teller County. When you move to Teller County, you cannot take your plan with you. Your Advantage plan must stay here in El Paso County. When you get to Teller County, and you have an address there, you have a couple of choices. You can either enroll in an Advantage plan that's available in that county, or you would have a small window of guarantee issue into a supplement. And that is because it's through no fault of your own that you couldn't take your plan with you to Teller County. That is considered a form of involuntary loss of coverage. The other way that could happen is if you have an Advantage plan, you're in El Paso County, and that company decides to pull that plan out of the county. Again, that's loss of coverage through no fault of your own because they're yanking it away from you. They don't want to have coverage in that area anymore. That provides you an opportunity to either find another plan available in that county or have a small window of opportunity, 60 days, to have guarantee issued into a supplement. Another way you can take advantage of that and have an additional opportunity of guarantee issue is by accessing the test drive option for Advantage plans. Because Advantage plans have become so varied so quickly with the Medicare program, there is a lot of misinformation and a lot of confusion about what these plans are and what they do. And unfortunately, there was quite a few years there where insurance companies took advantage of that. And a lot of people would enroll in these plans thinking they were enrolling in something else. Because of that misinformation and misunderstanding and confusion of what these plans are, and honestly, the insurance companies taking advantage of that and taking advantage of people enrolling in them, Medicare created what they call a test drive. What this means is that Medicare gives you an opportunity to test out this kind of coverage without being locked into it. So if you decide you want to try out Advantage plans to see if it's going to work for you, see if that's the kind of coverage you're comfortable with for the long haul, you can either take advantage of that when you first get Medicare by enrolling in an Advantage plan first. You would have up to 12 months from the time you enroll, up to 12 months to test that plan out, test that kind of coverage out. And if at any point during that 12 months you decide that's not for you, you want out, you want back to original Medicare, you should have gotten a supplement. Anytime within 12 months, you can change your mind and still have guarantee issue into a supplement. Keep in mind, though, that that 12-month window of test drive also coincides with your 6 months of guarantee issue into a supplement, because this is when you first get Medicare A and B in effect. So basically what that means is it can extend your guarantee issue into a supplement from 6 months to 12 months, because you get up to 12 months to test drive the Advantage plan and still change your mind with guarantee back into a supplement. So it kind of extends that 6 months into 12 months in this situation, but you have to try out the Advantage plan from day one. The other way you can take advantage of the test drive is if you enroll in Medicare supplement from day one and you maintain that supplement without any break in that coverage for a year, 5 years, 10 years, however long. And then 1 year you just decide you want to try the Advantage plan. All your friends have it. They always make fun of you because you pay premiums and they don't have to pay premiums. So you want to try it. As long as you've maintained your supplement coverage without any break in that coverage, you can drop that supplement during an annual enrollment period, enroll in the Advantage plan for January 1st, have up to 12 months to test drive that plan out. If you decide you don't like it, you want your supplement back, you can drop that Advantage plan with any time within that 12-month window and have guarantee back into the supplement you dropped. Those are the two ways to take advantage of a test drive for Advantage plans. So I will take a couple of quick questions. Let's see. What if you sign up the first time 3 months before your 65th birthday? Do those dates change? No, because even if you sign up or enroll in Medicare within 3 months prior to your 65th birthday, your Medicare doesn't go into effect any sooner than the month of your birthday. And it would go from that date forward. That's when your clock starts ticking for these opportunities. Next question is, how do you know which is best, Advantage plan or supplement? Well, that is the question, isn't it? That is the key question that everybody needs to decide. There is no easy way to tell. What you have to consider, and the reason we do this presentation is so that you can see all the pros and cons of these coverages and hopefully make that determination yourself. Which type of coverage are you more comfortable with? Are you more comfortable with paying a slightly higher premium to know that no matter what down the road, Medicare and that supplement is going to pay your bills? Or are you more comfortable with an Advantage plan? You know, you don't doctor very often. You're one of those people that don't think you're ever going to get sick or anything's ever going to happen to you. Advantage plans primarily are zero premium plans, so there is no extra premium to pay on top of Medicare, where those supplement plans have premiums, $100 and more. You buy Part D drug coverage separately for an additional premium. Advantage plans come with drug coverage. So you save a lot of money with Advantage plans on the front end, but Advantage plans work differently than supplements, which we're going to talk about next, in that you pay at the time of service with Advantage plans. So if you have a major medical event down the road, you're going to be paying a lot of copays for those medical services and needs. And whether or not that outpaces the money you saved in premiums up until that point is something you got to decide you're comfortable with. Either way, it's a gamble. And either way, if you have health issues in the future, they're going to get you. They're going to get you coming or going. And that's unfortunately the bottom line. You either pay out of pocket in premiums or you pay out of pocket in copays if something happens. But you have to decide based on this information what you're comfortable doing. And that's really the only advice I can give you in how to know which is which. And the next comment is, why is this so difficult for people? People are not always mentally able to go through all of this. Yeah, no, I get it. This is not something that they have made easy. It's kind of at the government's end, the difference between, do we give people choice and options, or do we make everybody wear the same shoe and hope it fits? They've opted to go with the choice direction, so that you have choices and options to choose from, so that you can find something that's the best fit for you, but that does not mean it's an easy decision to make or an easy thing to understand. That's why I'm here. That's why our program exists, and that's what we're here to help you with. And so even though we're going to go through all this information in depth, people still have questions, and we are still always available to talk to you one-on-one, even after these presentations. So don't feel like this is it and this is all the information you're going to get. If you still have questions, you still want to go over this information some more, I'll talk to you 3 and 4 times if that's what it takes for you to feel comfortable. And we're happy to do it. That's what we're here for. So I get it. It's not easy to understand, but that's why we're here, and that's what we're willing to help you with. So don't hesitate to contact us. All right, so let's talk about how these plans are different than supplements. You will have some different types of out-of-pocket costs. Again, you still have to pay Medicare, still have to pay that premium for Medicare. You may have, depending on what you choose to enroll in, a lower monthly premium for an Advantage plan, but again, most Advantage plans in our area are 0 premium as long as you pay for Part B. And you will have out-of-pocket costs at the time of service in the form of copays or coinsurance or deductibles. Again, generally you're going to get any and all services that is covered by Original Medicare through the Advantage plan. They cannot choose not to cover something that Medicare would cover. Many plans will include prescription drug coverage, although there are some plans that do not, and those plans would be typically geared towards people who do not need a Part D benefit. For example, if you use the VA pharmacy, that's considered credible drug coverage. You would not need to buy a Part D if you use the VA pharmacy. You could get an Advantage plan that didn't include drug coverage. Limitations to these plans is you may be limited to what providers and hospitals you can go to. These plans may contract specifically with a network of providers, and you may be limited to that network of providers. However, in an emergency situation with any plan whatsoever, you are covered anywhere in the U.S. in an emergency. But benefits and cost sharing and how that works is a little bit different than Original Medicare. And just to make it a little more complicated, there are many different kinds of Advantage plans to choose from, and each one works a little bit differently. So there are HMOs, PPOs, fee-for-service plans. We've got special needs plans in Colorado. And then this last year, they decided to come up with an additional option, which is a hybrid that tacks on a POS benefit or option to an HMO or a PPO, which POS means point of sale or point of service. And it's just an extra layer of how you get those benefits through a plan that has that POS at the end of their designation. So, you know, if you've ever been in an HMO, while other options available in Colorado is the PACE program, which is it stands for Program for All-Inclusive Care of the Elderly. It's basically a program for Medicare and Medicaid population. Colorado does not have any insurance companies that offer Medicare savings accounts, and we currently do not have any demonstration or pilot programs. So primarily you're going to see HMOs, PPOs, fee-for-service plans, or PACE and special needs programs. If you want an all-inclusive list of the plans available throughout Colorado, the best way to get that all-inclusive list is either to order a Medicare and You handbook specific to Colorado by calling 1-800-MEDICARE and requesting it. Or you can go to the Medicare website and use the plan finder, type in your zip code, and it will pop up all the different plans available in your zip code or your county of residence. So how do these individual types of plans work? I'm going to breeze through them real quick, the different kinds of Advantage plans. We're going to start with HMOs. If you've ever had an HMO or been enrolled in an HMO through work or spouse's work, you know how an HMO works. Excuse me. And an HMO is an HMO is an HMO no matter how you have it. Medicare is no different. In HMOs or health maintenance organizations, you are limited to getting services within a network of contracted providers and facilities. You are not allowed to get services out of network if you want the insurance to pay. Typically, you could be required to get referrals to see specialists or for other services. You could be required to get prior authorization for some services. You go out of network, you're paying out of pocket. Insurance does not pay for out of network care. HMOs will always include the Part D benefit. PPOs have a little more flexibility, preferred provider organization. PPOs typically have a network of providers and facilities that they do contract with, and if you stay within their contracted network of providers, you will pay lower copays. But these kinds of plans allow you to go out of network without question, without asking. And because you are allowed to go out of network, no referrals are required, although some prior authorizations may be for some services. The key is if you go out of network, you have to make sure that whatever provider you go to out of network is willing to accept your plan and your plan's payment, and you will pay a higher copay for that out of network provider. These plans may or may not come with Part D coverage. If they do not include Part D coverage, you need to have a reason to not need Part D coverage because you wouldn't be allowed to buy it separately. Fee-for-service plans are the most flexible option. Fee-for-service plans are basically plans that do not contract a network of providers or facilities. So you can go to any provider that's willing to accept your plan. Their payment and your copayment is payment in full for services. Basically what that means is it becomes your job to find the doctor willing to take your coverage. Because there is no contract with these providers, there's no guarantee that the provider will be willing to take you and your coverage more than once. So doctors can choose on a case-by-case basis if they want to see you as a patient and take your insurance. But because there's no network, no referrals are required, no prior authorizations are probably required, you can go anywhere you want as long as the provider will take your insurance. If these plans do not include a Part D benefit, you could purchase a separate Part D so you have that coverage. So you're not limited to not having to need another option. So again, these could be the most flexible option, but they could also be the highest option as far as copays for services. And you have to do all the work to find the providers. Special needs plans are basically HMOs that are specifically designed for people who have Medicare and qualify for Medicaid, typically long-term care Medicaid. They can also be applied to people who have specific chronic health conditions or are in certain types of long-term care facilities. So these plans are specifically targeting those specific types of beneficiaries. Special needs plans are not available in all areas of Colorado, and if anybody wanted additional information about these kinds of plans, you can call Medicare or you're welcome to call us and we can talk about it in more detail. These plans will always include drug coverage. And then the PACE program. This program is specifically designed for people who are Medicare and qualify for Medicaid long-term care. This is basically going to be an HMO on steroids because they take the phrase health maintenance organization or managed care to the nth degree. So these plans, again, are going to be for Medicare and Medicaid beneficiaries, but these plans will certainly get much more involved than most insurances in someone's daily life by making sure that they have medication management, they have social work services and case management. This plan is basically designed to help people stay in their homes for as long as possible, versus without this plan, they might have to go into a facility of some sort. So you do have rights with these kinds of plans. Obviously, you have the right to access healthcare providers. You have the right to know how these providers get paid. You always have the right to fair, efficient appeal processes and fast-track appeal processes in certain situations. You have the right to get the services that you need through these plans. You have the right to get information about these plans in easy to understand language. And of course, you have the right for all of your information to be kept private. So let me see if we got any questions before we move on. Is it possible to need Part D and pay for another plan too? So with Advantage plans, you can find Advantage plans, the PPOs and the fee-for-service, that may not include drug coverage. If you do a PPO without drug coverage, no, you cannot get Part D in addition to that. If you get a fee-for-service without drug coverage, yes, you're allowed to get Part D in another form, like a standalone plan. If you get a Medicare supplement, that doesn't come with Part D either, so you have to buy a standalone Part D in addition to that. I am hoping that answers your question, but if it doesn't, please let me know. If you get an HMO, that's going to include drug coverage, and any of those other Medicare and Medicaid programs include drug coverage.
Excuse me, I was kind of just wanting to know, like, is it possible that you end up paying for Part B? So you have Part B you pay for, then you end up paying for Part D because you need the drugs, but then also you need some kind of like Medicare Advantage plan or supplement plan. So you'd be paying 3 different payments?
Correct. Well, yeah, typically if you always have to pay for Medicare Part B, that's a given. You don't get out of that. If you get a Medicare supplement, you pay a premium for the supplement. You have to buy a Part D plan in addition to that, so you have to pay a premium for the Part D. So you're paying for 3 insurances if you have Medicare, supplement, and Part D. Advantage plans, if they include drug coverage, at no extra cost. And if you have a 0 premium Advantage plan that includes drug coverage, it's still 0 premium. All you're paying is your Part B. But again, the difference between the two is if you're paying 0 premium Advantage plan, you're paying copays at the time of service. If you're paying for a supplement where you're paying premiums every month, and then something happens, you pay nothing at the time of service because that insurance is designed to pay it all. So that's kind of the breakdown, the difference. So if you have an Advantage plan, typically are not going to be paying extra for a Part D. Any other questions? I know we're running late on time, so I'm going to try and get us through the last of this as quick as I can. So again, I mentioned before that there have been a lot of misunderstandings, a lot of misinformation, a lot of confusion about these kinds of plans. And unfortunately, a lot of that has to do with how they are marketed. So Medicare had to come up with a bunch of rules regarding how these plans are marketed. There are many, many things that insurance agents and brokers are not allowed to do when it comes to trying to sell these plans to you. I've pretty much got a couple of pages of do's and don'ts. Things that agents are not allowed to do are approach you in public areas, parking lots, sidewalks, lobbies, hallways. They cannot send you unsolicited text or make unsolicited calls, cold calling. However, if you've ever had a relationship with an insurance company in any way, shape, or form, even if it wasn't for a Medicare product, and your name is in their system for some reason, they can text you, they can call you, because you've had that insurance in some form or fashion in the past. They can sell you junk or send you junk emails, as long as those emails have an opt-out option or unsubscribe option. And of course, as I'm sure many of you know by now, they can send you junk mail through the mail. And if anybody's getting ready to become eligible for Medicare, you are probably being inundated with junk mail already. They cannot ever use the term free to describe zero premium plans or to describe reductions in the cost sharing or deductibles. If you intend an event for marketing or even educational event being put on by an insurance company or agent, they cannot require you to provide your contact information as a prerequisite of attending that event. Basically, they cannot make you sign in if you go to a sales event or an education event. And if they require that you sign in or imply that you have to sign in and give your name and phone number or whatever, they're doing something wrong. They cannot require that. They cannot camp out or have little tables set up in doctor's offices or at pharmacy counters. They cannot do that. They cannot represent themselves as being an employee of the government or Medicare. They cannot conduct marketing at educational events. So if someone is insurance agent is saying, I'm going to do a Medicare 101 and tell you everything you need to know about Medicare, kind of like what I'm doing here. During that educational event, they cannot try and sell you anything. They cannot focus on whatever it is they sell. They can only tell you general information about Medicare. However, they are allowed to have a marketing table right outside the door of that event for you to grab their marketing materials at the end of that event. They cannot buy you dinner or lunch. They can provide snacks and refreshments, but they cannot buy you a meal. They cannot offer free items or services worth greater than $15 per person. They cannot decide not to give someone a gift if that person does not choose to enroll in a plan during a marketing event. They cannot go door to door, period. They cannot put flyers at your door. They cannot put, their business card in your door jamb. They cannot go to door, period. If someone shows up at your door uninvited, they are violating the law. Things that they do have to do, they have to submit any marketing material to Medicare for approval. They have to comply, as we all know how well that works, with do not call registries. They have to obtain permission to contact you, which is called a scope of appointment, meaning you have to put in writing that you want this agent to come talk to you about whatever product that agent sells. They have to put that in writing. And at that appointment, they are supposed to present you with what's called a scope of appointment that tells you what they're allowed to talk about during that appointment. If you set up an appointment to talk to someone about a Medicare Advantage plan, that's all they're supposed to talk to you about during that appointment. If that particular agent actually also sells Part D plans or supplements, in addition to Advantage plans, they would have to have you sign a separate scope of appointment at the end of the first talk that says you want them to also talk about now a different kind of insurance. How well they're doing that is hard to say because it's hard to police that kind of documentation, but they are supposed to put all of that in writing and keep it all on file. So if you're not being presented with that information during an appointment, something's wrong. And I did include in the material that I emailed you earlier, some additional marketing information handout that kind of goes into more detail about those documents and those regulations. So to wrap it up, if you are seriously considering a Medicare Advantage plan, ask yourself a couple of questions. If the plan includes a drug benefit, make sure that plan covers your specific drugs. Every Part D plan and every Advantage plan that includes a Part D benefit will have a different list of drugs they cover. No two drug plans are alike. That's why there are so many of them. So make sure that your specific drugs are covered by any plan you are looking at. If you have providers that you want to keep, you don't want to have to change doctors, make sure your doctors take any of the plans that you are looking at. Because if you don't check with your doctors and they ultimately do not take those plans, you will have to find another doctor. In the past, this has been more of an issue, but in this area, we have 2 primary hospital networks. Some people have strong preferences about one over the other. If that is the case, then you might want to check with the plan as to which network they participate with, although many of them are now participating with both. If you doctor a lot, so Advantage plans cannot underwrite. They can never turn you down for any reason whatsoever. If you enroll in one of these plans during an enrollment period, they have to take you no matter what your health is. They do not underwrite. So if you doctor a lot and you choose to go in this direction anyways, it'd be a good idea to check if that plan requires referrals to see your specialists. And you'd want to make sure those specialists are also in that plan's network. Keeping in mind that a lot of these plans may require that you see your primary doctor to get that referral to see the specialist, and that could potentially be an extra copay that you have to pay for that process. I know a lot of people are very, very interested, and they are marketed very strongly on all of the extra or supplemental benefits of Advantage plans. The dental is a biggie, biggie, biggie. Vision, free gym memberships. I know everybody saw those commercials last fall with Joe Namath and all those actors, J.J. Walker, talking about the Medicare premium buyback or payback. Some plans do offer that, although no plans in our area will offer to reimburse you for all of your Part B premium. There are a couple of plans that will reimburse some of it. But if those are the kind of benefits that you are interested in looking at, make sure you ask a lot of questions on how to access those benefits, how to activate those benefits, what kind of network those benefits participate in. Can you go to see your own dentist, your own vision providers, or do you have to use theirs? And what the maximum benefit availability is or amount is to get those services. Ask lots of questions. Don't just take their word for it. If you're getting the sales pitch, ask a lot of questions. And that's all I can do is not stress that strong enough. I did include an additional handout that goes into a little bit more detail, as well as providing some pro and con information on the different types of Advantage plans available. Very good document. Again, we're lucky that the Division of Insurance puts this together for us, our Denver office. So hopefully you'll find that helpful. I also included this chart. This is basically a side-by-side of all the Advantage plans available in El Paso County alone. 2 sides, there's a lot of them. There's a huge range of them. You've got all the different types, the PPOs, the HMOs, the fee-for-service. This tells you if they have a premium, tells you what some basic copays are, includes information about whether or not there's a Part B buyback, that kind of stuff. I do not go into detail about those extra benefits. You'd have to contact the plans directly. But this is a nice side-by-side to compare some costs with the different plans out there. Max out-of-pocket amounts, that kind of stuff. I also have a chart similar to this for Teller County and Park County. I have not had time yet to do my other 6 counties, but I do intend to try and get that done in the next couple of months. If you are in the Park or Teller County area and you would like a chart for those counties, just contact me. I'm happy to send it to you. And then we talked briefly about the Medicare savings plans. I'm not going to go over it again because we are pushing for time. But just to reiterate, if you have limited or low income and you could potentially fall within these income and asset guidelines, we do help with those applications, and it could help save you some money, at the very least the Part B premium that they take out of Social Security. Again, our office is also the S&P office for this region, which is the Medicare Senior Medicare Patrol, or the Fraud and Abuse Education and Advocacy program for the SHIP. So we are always happy to help you if you have questions about claims, you're suspicious of activity of any sort when it comes to insurance, marketing, telemarketing, emails, anything like that. We're happy to talk to you about that and see if there's a problem. And with that, I will conclude. So let me look to see if there's any other questions. And again, if you have a question, you're welcome to raise your hand. So I see a comment, 3 months before 65, can we immediately sign up for an Advantage plan, or do we have to contact Medicare first and then tell them we sign up for an Advantage plan? No. So once you are actually enrolled in Medicare, and if you can coordinate it to where you know Medicare is going to start the first day of April, because you enrolled in Medicare in February, it's going to start in April because that's the month of your birthday. 30 days prior to April, you can also enroll in an Advantage plan or a Part D plan or a supplement so that it starts the same time your Medicare A and B start. But you do not have to tell Medicare that. The plan themselves will tell Medicare when you've enrolled. So you do not have to make that extra contact. And I think that's all the questions in the chat. Were there any other last minute questions before I let you guys go for the rest of the evening? Let's see. All right, I'm not seeing any. I'm not hearing any. Again, thank you all very much for joining us. Thanks for hanging in there and sticking in with us tonight. This was a lot of information. Please feel free to contact us if you have any other questions or would like to schedule a one-on-one appointment. And hopefully we'll see you all next week when we talk specifically and solely about Medicare Part D.
When can we see page 2 of this MAP plans?
The whole document should have been included in the email that was sent out. And if you did not get that email, we will be sure to get that to you if you let us know who you are.
Like it says see more plans and important notes on back page, but I didn't get the back page.
Oh, there should have been 2 pages to that document when I sent it out.
Nope.
Yeah, if you leave your contact information or in the chat, I'll make sure that you get that sent again.
Thank you.
Thank you. Any other questions or comments before I let you all go? All right, well, thank you all, and I'll let Jared wrap it up.
All right. Thank you very much, Roma, and thank you all for taking the time to join us for this Medicare webinar series. As Roma mentioned, our next series will be next Thursday at 5:30 p.m., which will cover only Medicare Part D. If you haven't already registered, you can do so at ppacg.org/events. You're going to be receiving a survey after this webinar is complete. We would appreciate your feedback on your thoughts on this webinar and how it can be improved. This webinar will also be available on demand on our website, where you'll be able to also view last week's webinar, which covered Medicare eligibility and coverage for Parts A and B. Thank you again for attending, and have a great night.